Hi friends, my name's Jessica and I'm a second-year doctoral student studying nursing practice. In today's video, I want to talk to you guys about the ACE study. This is one of my favorite studies and I think it is something that every nursing student should know about. I did not learn about it in nursing school, but I wish that I did, and I wish that they talked about it more. The ACE in ACE study stands for Adverse Childhood Experience. These are things like physical and emotional abuse, neglect, having a parent with a mental health disorder, and seeing household violence that is experienced in childhood. The more ACEs, or adverse childhood experiences, that a child has, the more likely they are to experience various health conditions such as depression, heart disease, substance abuse, PTSD, poor academic achievement, and other health conditions later in life. If the child does not have supportive adults, this can also lead to long-term toxic stress. This toxic stress is excessive activation of the stress response within the body, which causes wear and tear, leading to these various declines in health. So the ACE study is a test that you can give to patients or a person in general, and each time they answer yes to one of the adverse childhood experiences, they get a point. The more adverse childhood experiences they have, the more likely they are to have various health conditions, which we're going to go over later in this video. So I'm going to insert a couple slides that show Felitti, which is one of the researchers, his work and his outcome for one of his studies. He studied over 17,000 individuals in a very long study, and these were some of the results that he found. So let's check those out and then we'll talk about them after. So I want to show you guys some interesting data. This is from a study done by Felitti, and I will link it in the description. But as we can see, this graph shows your ACE score at the bottom and then shows the percentage that you have of whatever disease they're talking about. So here it's chronic depression, and we can see that it increases with the more higher of an ACE score that you have. So adults with an ACE score of 4 or more are actually 460% more likely to suffer from depression. Let's look at another one. So we can also see that when it comes to suicide, there is a very obvious increase as ACE scores increase. So the likelihood of an adult to commit suicide that has an ACE score of 7 or more is 3,000%. That's a 30-fold increase. And they also found that children and adolescents, they have a 51-fold increase, so 5,100% increase with an ACE score of 7 or more. This is just showing 4 or more, but if you break it down, the results, it would be those for 7 or more. But I mean, we can see there's a huge difference. Let's look at another one. So ACE score and hallucinations, and dependent on did they abuse alcohol or drugs to cause these, but again, we can definitely see that increase. Let's look at another one. This one is showing impaired memory in childhood, so we can see as the ACE score increases, the percentage of impairment also increases. So let's quickly look at some health risk behaviors. So adverse childhood experiences and current smoking, again, we can see that increase. A child with 6 or more adverse childhood experiences has a 250% more likely chance to become an adult smoker. And a person with more than 4 ACE categories has a 260% chance of having chronic obstructive pulmonary disease. I think there's another graph for that one. Let's look at alcoholism. I think that this one is really great because it's important as us as providers to understand, substance abuse and what that history can sort of entail. So, I mean, there's a 500% increase in adult alcoholism related to adverse childhood experiences. And they've actually found that 2/3 of all alcoholism can be attributed to adverse childhood experiences. IV drug use, this is just unbelievable. I remember when I first saw this graph, it was like a light bulb went off. I think a lot of people lack sympathy or empathy for substance abuse patients. At least I see that a lot in the hospital. And I think that this really shows, that there's a lot of pain there. So as we can see, going from a 0 ACE score up to a 4 or more. So they found that a male child with an ACE score of 6 has a 4,600% increase in likelihood that they will be an IV drug abuser. I'm skipping some of the graphs because there's just so many, but if you guys YouTube, ACE studies, there's lots of great lectures. There's actually one by Felitti himself who did the first big ACE study. So here's a great one showing victims of domestic violence. So you can see that the more adverse experiences as a child, the higher risk of becoming a victim of domestic violence. And this is kind of in both cases for women and men, but we can also see that big difference in women. Here's one perpetrating domestic violence. So just the same as it increases for becoming a victim, it also increases for perpetrating the domestic violence in both women and men. Okay, so here's a great one. ACE score and the prevalence of liver disease. So again, we can see the higher the ACE score, the greater prevalence of liver disease. Here's another great one, COPD. Again, the higher the ACE score, the increased risk of COPD. ACEs also increase the likelihood of heart disease. So we can see this here. There's so many great graphs. So here's one, the higher the ACE score, the higher rates of being prescribed antidepressant medications, higher rates of being prescribed antipsychotic medications. This shows the higher the ACE score, the more likely you are to die younger. So this is the percentage in the age group. So we can see that if you have an ACE score of 4 or higher, you're a very low percentage of being older than 65 years old. So as you can see, if adults have higher than a 4 on the ACE studies, they are much more likely to have behavioral, physical, emotional, and various health conditions related to their ACE study score. They're more likely to have reduced physical activity, they're more likely to smoke, they're more likely to be obese, they're more likely to have missed work and have drug abuse, they're more likely to have diabetes, to have suicide attempts, STDs, chronic lung conditions, cancer, heart disease, and even broken bones. A thought is that this could be related to epigenetics. So epigenetics are, we have these certain genes, our genetics, and all of the genes in our bodies aren't turned on, right? We have like this coding, but it doesn't mean that they are expressed. They're just there. So the thought of epigenetics, or the study of epigenetics, is figuring out what turns on those genes. Now, this is super interesting because it means that something in our environment, most likely, is what activates these genes. So a thought is that these adverse childhood experiences activate the genes that are linked to these different behavioral and physical health conditions. So one thing with the ACE study is that the long-term stress can lead to something called toxic stress. This is the constant wear and tear on the body because it is in a stress response mode. Toxic stress affects different parts of the brain. The stress pathway leads to anxiety, depression, and impaired learning. Emotional processing and regulation leads to hypervigilance and reduced attentional control. Evaluations of rewards lead to difficulty experiencing joy. And brain connectivity leads to understanding the relevance of a situation and how to respond. So now that we've talked about what the ACE study is, we can talk about how to prevent adverse childhood experiences. Now, we would want to do this because it would reduce a lot of the physical and mental health conditions that we see in the hospital if a large majority of those are due to adverse childhood events. If we could reduce the amount of adverse childhood experiences, we could therefore reduce the amount of patients in the hospital for these various disorders. So there are various programs. There is one created called HOPE Initiative. This is something where they educate healthcare workers on how to prevent ACEs. So if you're working in the pediatric setting or in the PD psych setting, this might be something that you want to look into. However, one of the main ways to prevent ACEs from happening is to provide education and awareness of ACEs and their long-term effects. So to do this, we can change the way that people think of ACEs, and we can educate people on how to prevent them. We can shift the focus from individual responsibility to community solutions. We can reduce stigma around parents seeking help, especially for things like substance abuse, depression, or suicidal thoughts. And we can provide safe, secure, nurturing relationships for children to play and thrive. So that was a summary of the ACE study. I hope you guys enjoyed this conversation, and if you enjoyed this video, make sure to give it a thumbs up and subscribe to my channel, and I will see you guys next time. Bye.